Hi, I'm Debbie Goodman, and this is Dr. Diego and Debbie, featuring Dr. Diego Allende.
Hi, Deb. How are you?
I'm doing well, thank you.
Good to see you.
Thank you. I want to talk to you today about thyroid because you mentioned in one of our previous videos that artificial sweeteners can have an adverse effect on our thyroid. And you know, I think that's what happened to mine because they had just come out with a new and different one back in the day, about 25, 30 years ago. And it was much sweeter than sugar. And so I was using that stuff, and I noticed I'd get headaches and things like that. And within a couple of years, I started having serious thyroid issues.
Yeah, so, you know, no names in particular, but there are some products on the market, and in particular, one of them uses chloride as one of the base products in the sweetening process. And unfortunately, chloride is more unstable than iodine is in the periodic table of chemicals. It's a little bit higher up, which means it only requires one more electron to stabilize its ring around the protons and neutrons. And so, because it's more unstable, it's able to displace iodine. And in that case, in the production process of making thyroid hormone, iodine is an absolute essential mineral. It's part of the backbone. That with tyrosine, and tyrosine is an amino acid, you need those or you just cannot make thyroid hormone. And if you have chloride placed in there, then you're going to have non-functional thyroid hormone. And so it's competing, and chloride has a stronger affinity for that receptor site, for that mineral receptor site, and so therefore you're not going to have functional thyroid. So that's not an uncommon thing. We've seen that in the literature. I try to steer people away from those type of sweeteners. Sometimes some of the natural ones out there, plant ones, those are okay because they don't have any type of chemicals or a mineral that may displace iodine.
Okay. Yeah, I'll give a push for stevia because I love stevia. And the thing of it is sweeter than sugar. That was one of the things they did was a comparison. They said that a teaspoon of this artificial sweetener is sweeter than a teaspoon of sugar, which was true. Another thing that I understand may have an adverse effect on the thyroid function is soy.
That's correct. So soy, in fact, can impair the ability of thyroid hormone to be produced and to function correctly in the body. And so we try to steer people away from using soy products, in addition to the fact that it's a precursor to a plant hormone. And so plant hormones or sex hormones are not human hormones, and therefore you want to avoid products that are in soy. And most of the soy in this country is, in fact, is genetically modified. So that's another reason why you don't want to consume something that's not made in nature naturally. And so, because we don't know about the full ramifications, we do not have studies on foods like that long term. And whether they're being done or not now, I'm not even sure of. So I always steer people away from those type of food products. Some people like you said, like soy products. Soy is a good source of protein. At the same time, you got to weigh out the risk, benefit, reward. And I think if you're someone who's at risk for or who's had a malignancy related to the sex steroids such as breast cancer or something like that, then you may want to avoid those products. But again, it can interfere with thyroid production. One thing that people never really read about or hear about, unless they really are familiar with thyroid function, is that eating too much brassica vegetables or the cruciferous vegetables can cause dysfunction in thyroid production as well, and its efficiency. And so I'm not telling people that they should not eat those vegetables. Those vegetables are absolutely essential for a good function. They have a lot of things that are in them, antioxidant support and anti-cancer products and things that can be produced in them that is absolutely beneficial for people. However, if you've got a thyroid disorder, you may need to have your thyroid hormone adjusted.
Okay.
And you should be aware of that. And again, if you're worried about, because you eat lots of these vegetables, things like cauliflower and radish and broccoli, those type of things. So you may be fearing a slower functioning thyroid. So in that case, you just need to take the supplements, which most of us are probably deficient in to begin with, to make our thyroid more efficient and to make more thyroid hormone available. And so we could talk about that stuff too.
Well, I read a very interesting article. It's 121 pages long about all of the different supplements we can take to adjust the thyroid so that it is functioning. The thing that is, I try to tell people, they don't want to go to the doctor. They just want to know what everybody else is doing and try to copy it. I says, well, how are you going to know what you are deficient in until you've run some blood tests? Like, oh. But some of the things, there was like 9 important.
Yeah, there's about probably 9 like super important nutrients, but again, any stressful state can affect thyroid function. And although there's 9 nutrients that are like super important, all of your nutrients are important. But also having said that, if you're under a lot of stress, that can affect your thyroid hormone production. Okay, and sometimes people confuse thyroid dysfunction for what it really is, an adrenal gland dysfunction. And so we need to look at those things in our evaluation. Additionally, so that's a hormone imbalance. Also, if someone's menopausal or perimenopausal and they're making less sex hormones, then they're physiologically stressed. The thyroid hormone production may also be impaired, and so it may not be working adequately too. So that as well can be affected. So can heavy metal toxins, so can toxins in general into your body, sleep disorders, okay? Those can affect the thyroid production and how efficient it works or what you're making. Because remember, you're in a stress state, your thyroid hormone isn't a storage hormone for most of the time. So 80% of your thyroid hormone is in a storage form called T4. And then 20% is an active form called T3. There is conversion, and most of that conversion takes place in the gut, okay? So it's absorbed directly as T3 into the gut, but you have a reservoir of T4, which is 80% of it. The rest can be made in your peripheral tissues and at the area it's going to be used. So the T3 can be produced and become active hormone when it's needed, where it's going to be needed at that moment, what organ's using it. And every organ in your body, all animals, all creatures require thyroid hormone for metabolism, period. Don't have it, you will perish. And so super important that you have all the nutrients. You do some testing for toxins, and most people have heavy metal poisonings, gut dysfunction like a hyperpermeability gut or leaky gut as we call it. Those things play a role in it because there's other conditions that can arise, and we're not talking about that today, we're talking about nutrients, but things like Hashimoto's thyroiditis or hyperthyroidism or and what are the different types of hypothyroidism, and those are complex questions and answers. But for the sake of having a normal thyroid and function, you should do some testing if you're concerned about it. You should be careful and always go on the moderation side of whatever you're using to help replenish those nutrients in your body. But certainly people should eat a wide variety of diet every day to get essential nutrients so they get a better likelihood of absorbing all those minerals and vitamins necessary for hormone production or adequate hormone production, and making sure that they're managing their stress, that they keep the stress levels. Cortisol can affect functional thyroid, or the adrenal gland can make it perceived if it's a thyroid hormone, but in fact there's another hormone issue going on, is deficiency or overproduction, but then you get into what they call an adrenal fatigue state, which can make it appear that you have hypothyroidism.
Been there.
Right?
Been there, yeah. I had a lot of stress for a number of years. And I finally did one of those saliva tests, and that's what it came back and said I had. And I've gotten to the point where I literally could not stand up. I was getting ready to go to work one morning, and I felt fine laying in bed. Then I stood up, and it was like, oh my gosh. I didn't even have the strength to stand up.
Wow.
Some of the nutrients that they mentioned that we may be deficient in that would affect our thyroid function were things like magnesium, selenium, B vitamins, B12.
Yeah, B12, but B12 is super important in thyroid production, and so most people usually don't get enough B vitamins in their diet, and some people may have a metabolization or making the hormone available for usage genetic disorder. So some people may have, so even though we check for red bloods, or sorry, for B12 levels in your body, sometimes patients may not be able to utilize the B12 that they're taking. So specific testing, is probably very important, but B12 plays an important role in the effectiveness and overall just general sense of well-being for most patients, because it's used as a cofactor in so many metabolic reactions. And a lot of the supplements you're going to mention that play a role in a lot of metabolic reactions in our body that do play a role in your sense of well-being, in energy, and brain fog or cloudy thinking and fatigue, those type of things.
Yeah. No, I take my B vitamins and I do notice a difference.
Yeah, I always recommend taking a B complex because you're going to get B12, you're going to get B1, 2, 3, 5, 6, 9, and 12 for sure. So those are the originally, recognized B vitamins. There is some, we call them vitamins, but they're not really, in some journal articles, in some areas of nutrition medicine, we call things like choline a B vitamin also, but in some places they're not recognized as such. But the previous ones that I had mentioned, those all can play a role because they're all used as cofactors. So B1, 2, 3 is commonly used as cofactors in many metabolic reactions, including deconversion. So you got to make your thyroid hormone, right? And that requires tyrosine, iodine. You got to have it no matter what. And then you got this thyroid hormone, which is a prohormone, T4. And then the conversion of T4 to T3 is super critical. And that's going to require a lot of minerals too, like zinc and selenium, right?
Yeah.
So, and zinc plays a role in over 300 metabolic reactions in your body. So you need it. And people who have low level selenium have all kinds of problems, health problems and sense of well-being, fatigue, and all kinds of issues. So selenium deficiency is very high also. So when you put these together to help to convert to make an active T3 hormone, then people usually are going to feel better, but ultimately T3 converts into something called ATP, adenosine triphosphate. And it's those cleaving of those phosphate groups off that creates the energy that we utilize in our cells for metabolization or for function. So ultimately, in that one last step requires iron. So you're going to need some iron too, amongst other things. And people always say, what about my gut? What about my gut? Well, your gut's super important. And the question is why? Well, put it this way. If your gut, or your intestinal tract, is critically important for the absorption of amino acids such as tyrosine and iodine and all the B vitamins and zinc, if you don't have a normal functioning gut, how are you going to get all the minerals that you need to make effective thyroid hormone? People say, well, I'll just take thyroid pill. What if you don't need thyroid pills? What if you just need to take nutrition that makes it? So that's a reason why, to your point, they should probably be seen to be evaluated. Maybe they have got nutritional deficiencies that are the issue. Not so much you need thyroid hormone. Maybe just you need a well-balanced diet and some supplements that can give you proper production and absorption. I can guarantee you, most people, I put them on a few vitamins, you know this.
I do know this,
You feel better within a few days. You're like, wow, just the supplements. And that's telling you that you probably don't have adequate nutrition. And there's some thoughts out there that by a lot of leaders in the industry that work in bioidentical hormone replacement therapy, that maybe you just do a trial of B12 shots or sublingual oral supplementation. And maybe do testing for metabolization disorders like methylene tetrahydrofolate reductase deficiency enzyme. So that's important too because you can't metabolize B12. Maybe you do zinc and selenium levels, B12, because you can check those things and they're probably more accurate by doing them in the cell. Because in the cell, your body's using it. So you know it gets in the cell, so you know your body's using it. But if you can't get in the cell, if you just check the serum, and the serum is just your blood in general, then you don't really know if it's in the cell working. So you probably should check a specific blood type or blood cell. So like I usually order red blood cell, B12, magnesium.
You order
zinc.
everything.
Well, I'd rather not try to guess, but I can usually start you on a supplement, program. And if you feel better, you're saying, well, which one of the supplements helped? Not all of them helped, because what you're trying to do is you're trying to take enough supplementation to make up for deficiencies. And these days, guess what? Everybody is a little bit ADD, right? Multifunction, and you're all over the place trying to figure out your schedule. Everybody's trying to exercise and be healthy. Everybody's got a busy lifestyle, and then probably someone significant in their life. If you've got kids or grandkids, you're always very busy, and you got a busy, demanding job. Think about nutrition that's being absorbed and consumed in your brain function and organ function. So, again, to your point, supplementation is important. Some testing is critically important. I think if you just say, why don't I just take, the recommended daily allowance? Well, I think the RDA is the minimum necessary to avoid disease. And in my world, I don't give people the minimum necessary to avoid disease. I'm a functional physician, and so I optimize health. So I'm shooting for the higher end of normal to optimize my patient's function. And if we're not going to do testing, then I want to lean towards that, especially if I take into consideration their activities and how busy they are and the demands on their life. But if I can do the testing, then I want to do some testing periodically to see if I'm over-treating, under-treating, or if we're on point. Overall, the most important thing, what comes down to when I reevaluate my patient is, how do you feel?
Yeah.
Some patients may have chronic inflammatory diseases, which decrease the use of their thyroid hormone and its production, so that's super important. But that could also create autoimmune diseases. And the autoimmune disease, particularly in the thyroid, can make the thyroid not work as good either, because the antibodies you create kind of attack your own thyroid gland, so you don't make effective or useful thyroid hormone. So part of a workup sometimes includes checking to see if you have these type of autoimmune antibodies, because certain type of nutrients and supplementation can improve that antibody outcome, whether you're making a lot or reducing them substantially, like selenium can do that. And selenium has a lot of great properties in that it's antioxidant producing enzymes, will play a big role in your thyroid, in your body as well. So I think it's super critical that we think about those things, and if you have a gut problem, you probably should be on some probiotics, And probiotics are bacteria. It's just packaged up bacteria that helps be replaced in your gut, because, again, if you've got stress, if you've got some type of food toxins, if you used to be a sugaraholic and you have, right? Well, and if you've got it's like overgrowth of fungus,
Right.
like Candida in your gut, or if you've got some other conditions like small intestinal bowel overgrowth, bacterial overgrowth, things like that, that can impair your ability to have normal function, normal production, normal absorption. So I think that looking at replacing gut bacteria for digestion is super important, and maybe even enzymes too, to help break down those foods that you eat and make sure you're making enough gastric acid, because you need acid to break down proteins and such. So there's a lot of things that go into having a normal nutrient function. And so to your point about nutrients, you can take all those vitamins, but you probably should have normal gut function, and make sure you're taking probiotics if you're not, and then taking some digestive enzymes too, so that you're helping break those down so they can be properly absorbed.
Yeah, my downfall is sugar. I sometimes crave that stuff, but when I was a child, we didn't know what we know now, and we'd go to a restaurant, and they would have sugar cubes in little wrappers, and that's what I would sit and munch until dinner came. Yeah. And now, I'm trying to eat more whole foods every day. I really try to eat some type of raw fruit or vegetable, nuts, things like that. Things that are not processed, not in a can, whole and fresh as possible.
And I agree with that 100%. The more processed, the more additives, toxins possibly getting into your intestinal tract, the things that normally wouldn't be there.
Well, there was a time when someone made sort of a rash mistake in prescribing my thyroid medication for me. I had just left one doctor and gone to another, and it was an NP, and I was trying to explain to her that I had been taking half of a natural thyroid tablet and half of the levothyroxine. And I said, hey, I'm out of the levothyroxine. Until we get my blood labs back, I've got to have something. Well, long story short, she prescribed like at least 2.5 times what I should have been taking, which I felt was extremely careless. And the pharmacist didn't even catch it, because it's like, okay, I've been getting this medication here for how many years? And now all of a sudden it's been bumped up 2.5 times. Don't you question this? So, yeah, after about a wild 4 days of not being able to sleep and heart palpitations and dizziness and God knows what else. I don't know if that did any permanent damage.
If it was short-term use, how long were you on it for?
About 4 days.
Yeah, I think for short-term use, something that was going to happen on the acute side would have been like, possibly a heart arrhythmia, an abnormal rhythm, And if you didn't sustain that afterwards, it's probably not going to be permanent. Because remember, the hormones are temporary. They do their action and they get bound up and then they're not unavailable anymore. And so doing long-term damage require a really prolonged exposure. But it made you a little upset and it caused a permanent stain in your brain.
Oh, it did. And maybe a permanent stain on the NP's record.
Yeah. Hey, but in retrospect, you learned a lot there, and you also learned what you're much more careful and cautious about, and then you communicate that effectively to all the people you communicate with. So your audience and the people coming in your life, even with me, you've told me the story too. So I think that's great because that helps. It helps people become enlightened to the questions they should be asking, and maybe they should question sometimes what's being given to them. And I always think an informed patient is good, but I think asking questions is super important because you can build on that, and it's good for the relationship too, right?
Yeah, and we have come to the point where we do need to be more proactive because I was raised by parents who their generation didn't question. If the doctor said this or so-and-so said that, then it must be so. And then as time went on, they discovered a lot of things were not correct. And, I mean, smoking used to be, oh, hey, have a cigarette, you'll relax.
Yeah, just smoke outside the operating rooms, inside the hospitals.
Oh, my God.
Yeah, of course, that was some time ago. But not anymore. I'll tell you something about the thyroid hormone. When I was telling you about the thyroid hormone, the one that becomes the effective form, which is T3, okay? There's other forms like T2, T1, but it's the way they describe it, the nomenclature is based upon where these iodine rings are, the minerals are. And so the hormone can become activated or inactive when it converts to T3, depending on what enzymes are activated, if that makes sense. And then so it moves around a molecule, and then by taking off an iodine molecule, it can either activate the hormone or become inactive. And so the inactivity one, or the activation that can be stimulated by stressors, heavy metals, hormone imbalances, that kind of stuff. And so, remember I told you about those can affect thyroid function? Well, at the molecular level, I'm trying to explain to you how that occurs. Because you have these moving around, the shuffling around of all these iodine molecules. One will turn it on, one will turn it off, and one is the off storage, or the bank. That makes sense. The presentation of hypothyroid or poorly functioning thyroid can have as many as 200 symptoms associated with it. So what I'm going to say, probably some of the most commons are fatigue, low energy, brain fog, which can overlap into other conditions or deficiencies, right? Poor inability to lose weight. How about a heat intolerance or cold extremities chronically? How about chronic constipation? How about chronic pain? Because chronic pain can be as a result of having a slow or poorly functioning thyroid as well. So I think if one goes and reads a little bit of information on hypothyroid or presenting symptoms, probably most of us have quite a few of those symptoms, but for various reasons. But if you have some symptoms that you're concerned about and they seem to coalesce in this, what appears to be this, it's pointing towards a certain diagnosis, I think the most important thing to do is to come to the doctor and say, hey, I've got some symptoms that are concerning to me. Here they are. I'm kind of worried about my thyroid function, and I believe if someone has a family history of thyroid disorders, then that's a great indication for going to see your clinician and doing the workup to see if there is an underlying condition that may be starting or you have it's occurring. And again, it isn't always, okay, you need a drug. How about we start with some nutritional assessment too? And how about we start with some replacement depending on what you're taking or you're not taking, and see if we can make somebody improve function or feel better or reverse symptoms prior than just jumping into a drug. But if it's a severe condition, and we usually we can see those results on a blood workup to see if somebody's really severely hypothyroid, we start treatment immediately, and then we play catch up with the other assessments and workup. And that seems to make more sense because hypothyroidism can eventually lead to brain dysfunction, dropping of your IQ. It can lead to heart dysfunction, arrhythmias, all kinds of bad stuff if it's severe enough. And if you don't have enough thyroid hormone, you could eventually die.
Wow.
Yeah.
Yeah, I understand you can slip into a coma.
Yeah.
Yeah, that's what scared me when I had my little overdose. But yeah, I'll never forget it. It's like I've often told people, you only burn out the engine in your car once. Something you never do again. You never forget to change that oil.
That's right. You're right.
So, well, I really appreciate you taking the time out to talk to me about this.
My pleasure.
And what I strongly recommend to people, as I hear this every day, and I was guilty of it, they don't want to go to the doctor. They want to self-medicate or self-diagnose and self-prescribe. They figure, well, okay, he says take iodine, so I'm just going to go take iodine. Maybe I'll take some iron, then I'll get some magnesium. It's like, if you don't know what you're deficient in, find out.
Yeah, and that's super important. A variety diet is super critical too. Change the foods you eat every day.
Yeah, and that's true, and most of us don't. We'll get into a rut of eating the same thing every day for a while, and then we kind of go into a new phase, and then we eat the same thing. I'm probably guilty of that myself because I'm a seasonal eater.
It's also a convenience thing.
Yeah,
So,
so I eat certain things during the wintertime. Now, I love summer because I love summer fruit, as you know.
yes,
I share that love of watermelon with your son Valentino.
that's right. He loves it.
He's a smart boy. All right, well, thank you again.
Thanks so much, Debbie.
All right.
Thank you.